Kia ora, I'm Merepeka Raukawa Tait, and I'm standing again for the Lakes District Health Board. I was elected 3 years ago, and I must say it has been an eye-opener. We have quality health needs. We have quality health services that we are trying to provide here at the Lakes District Health Board, which I might add includes Taupo as well in that whole area, and we are trying to make sure that we cover the whole range of health needs and make the dollars fit as well. So we do have to balance the books. I have to say that that is an area that constantly comes up in conversation. I find it a bit frustrating, but nevertheless we have to spend our dollars wisely to make sure that we cover all the health needs of our community. I think wherever you have pockets of deprivation, and in Rotorua we do, then we will have a lot of respiratory, we have a lot of health issues with our young children, and some of that of course is because of the home situation and lack of heating in the homes, possibly overcrowding, and so those are issues that actually impact on the health of particularly young children. So there's the immunisation of children and making sure that those services are covered off. So that's a big one as well. And then we have diabetes, which is another one, and of course we have heart issues as well. So those are significant for Rotorua. I think health literacy is absolutely important. I think we need to get as much information through our GPs into the hands of the citizens of Rotorua, so that they can actually accept some responsibility and take some responsibility for good health outcomes for themselves and their families. So the role of the GP and strengthening that role, which we as the Health Board do have a role in playing, and also those frontline community providers, they're absolutely important. So what we have to do is constantly monitor what services are we providing, how well are we doing, and if in fact are we making a difference. And so we have to look out, hold the mirror up to ourselves and make sure that we are actually doing the very best that we can with the money we've got available. But I believe that it's the frontline community services. If we can move to put the resources there, because that's where the first contact comes in, and that's vitally important. And oftentimes it is the frontline community providers and doctors who get to the people first and get entree into their homes. That's really important.